Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. Today, Lima Dental Associates. So that means we have with us Dr. Wesley Shankland. Good morning to you,
Good morning,
Doctor.
George. Good to see you.
You want to talk about today something that everybody associates with a dentist, and that is cavities or decay.
That's right. Well, you know, we all go to the dentist and see the hygienist or the dentist, and they may say you have a cavity. And I've many people say, well, doc, it doesn't bother me. Well, I understand that. But you might see a crack in the wall or a crack in the floor. It doesn't cause a problem yet, but it's going to. It has to be fixed.
Right.
With a cavity in a tooth, if you don't get that fixed, it'll continue to slowly decay. You see, the enamel in our teeth is the hardest substance in the body. It's on the same hardness level as diamonds.
Really?
But it has no nerve supply. So you can't feel if there's a crack or if there's a cavity in your enamel until it gets through the enamel into a layer called the dentin. And that's where the nerve is located, the nerves. And so once the cavity decays through the enamel, through the acids in our mouth with the bacteria and sugars, it starts to cause a mild discomfort like a dull ache, a lingering ache, sensitivity to sweet things, hot and cold temperatures, things like that. If it continues, now it gets into this dentin, and ultimately, very quickly, it can get into the nerve of the tooth. And now you've got a problem where you have to have a root canal or you're going to lose your tooth, or you fracture your tooth, you're going to have to lose your tooth. So all of us hear that, oh, you have a cavity, well, I'm not going to get it fixed because it doesn't bother me, I'll wait till it bothers me. You need to get it fixed preventatively right away so it doesn't cause a problem.
In other words, if you start getting some of those symptoms, you ought to start thinking about it.
That's right. Let me tell you something, I'll tell you something, a secret between you and me and our closest 1,000 friends out there. I, as a dentist, lost a tooth because I didn't get it fixed and I was told I had a cavity.
Really?
It didn't bother me.
No.
And it was the very last tooth on the bottom. I forgot about it. Truly, I forgot about it. And I don't have a lot of cavities and things. Well, over a period of time, just like I had mentioned, it went through the enamel, into the dentin, and all of a sudden into the nerve, and the tooth died. So I lost a cavity, which, by the way, I went to Lima Dental Associates, and they took great care of me. So I know you can do that too. But get it fixed if you got a cavity, because if you don't, you're going to lose that tooth or have to have much more extensive and expensive work done.
If you go to the dentist and they tell you got a cavity, get it taken care of.
Right away.
Okay. If you ignore it, you're going to have problems.
Just brush the teeth you want to save.
Okay. And any good advice again for us?
Yeah, like Dr. Isabato says, keep smiling, sharing, and caring.
Thanks, Ron.
Thank you, George.